lecture is going to be different from all previous lectures. In the past, we have concentrated on diseases that they kill people. Basically, heart disease, heart attack, stroke, cancer, very incurable kind of diseases. We talked about the role of nutrition in those. And then when I talked to Joyce, I said, well, I'm going to start this year to talk about the symptoms people have. How can we find out what's wrong, and how can we alleviate some of these things using nutrition? So we actually take nutrition from one category, which is the medical field, to your symptoms, the one you complain about. And then we selected the topic today, that the aging process that takes place in the joints of women and men, and how can we prevent that? And also the skin, which is included in the same lecture. I'm not going to give any introduction of myself and all of that, but I'm going to ask how many people here for the first time in my lecture. Okay, we have about 1/3 of the people. Well, basically, like she said, I'm an internist, I'm a cardiologist, but I have a degree in agriculture. I was a farmer when I was a young kid with my dad. So we paid lots of attention to animal nutrition and vegetables and all of these things. So when I went to Cal University, that's the field I want to be in. And then when you do something you like, you achieve high grades. So I was one of the top in Egypt in biochemistry of vitamins and nutrition. God willing that I had to leave Egypt because the political system there was in chaos in 1968, 1967, 68, wars, and Russians were there and everything was bad. So I came to the United States. When I came to the United States with all the knowledge and nutrition I got, I was faced with a society that basically very much involved in chemicals. Everything was just chemicals in the air and water and food. And some of you, I'm sure, are chemists or biochemists, and you know that chemicals have no place in the human body except in certain jobs. If you have a drug, you want to kill certain germ or something like that. But the fact that allowing so many chemicals in the water and food for years, and the people who approve this chemical themselves for us, they really don't care, or they don't know, or both of them, what's going to happen 2 years from now, or 30 years from now. As long as they are in their office for 4 years or 8 years and gone, then they give their kickback, whatever, from the drug company, and they're gone, and the next one does the same thing, and then some of us have to speak. I wrote back to my brother, my twin brother, who is a medical doctor, cardiologist, cardiovascular surgeon. I wrote back to him, I told him that I like the people here very much, I like the society very much, but I think that there is a lot of hypocrisy right here in advertisement and contrary to what I thought when I was coming, that everything is truth and honest. And I was very disappointed to see so much chemical just being added, nobody challenging that. During that time, 1968, we formed the National Health Federation, formed the Prevention Magazine starts coming, and Adult Days starts talking about chemicals, if some of you remember those days or not. And recycling started, fighting the DDT in San Francisco Bay also started that. And then every one of us was doing his lectures in groups. We have to basically hide in houses to be able to lecture on preventive medicine or against anything against nature. Anything you say against nature, that's how you are coming. They arrest you for it. If you say that chemical is bad, you get arrested. If you say vitamin is good, you get arrested. If you say vitamin is good, you get arrested. Anything you do under the title, you're anti the government or anti the society. So that was a very hectic time, and some of my older friends here remember those days when we used to, ask anybody how to tape recorder so we can speak on nutrition. Nowadays, of course, it's a different story because people are more aware of what's going on. To try to explain to you this is the lecture tonight, by the way. This is the back of this change right here. represent the skeletal system, which made from many bones, which formulate the skeletal system of the body. And that system, if you take a piece of this bone and make it magnify it very big, you'll find it's made from cells. These bones connected to each other with joints. The joints also made from cells. If we cover this skeleton with skin, we find out also that the skin is made from also cells. Inside this body in front of you, there are multiple organs. One of them is the heart right here that takes food from the gut that you just ate and pump it all over the body. And other organs inside the body, such as the digestive system, which starts right here in your head, the mouth, and then little tank in your abdomen, and you know what is going to. This digestive system also made from cells. There is also other organs inside the body. One organ some people don't have right here, also made of cells. Another organ in the back of the body, the kidneys, right here, also does the job made from cells. So if we want to study how organs get sick, we have to understand that the disease process itself starts inside where? Inside the cell. If we wanted to then have a healthy body, we have to give that cell the nutrients it needs and remove the chemical it has. And if it gets sick by any infection or anything, we should help that cell before it dies. So we're going to right now magnify a cell to show you that the human cell, any cell in the body, it needs certain nutrients from outside. Those nutrients are not secret to anybody anymore. They are the protein and the carbohydrate and the fat and the vitamins and the water and the mineral and oxygen. These nutrients have to enter the cell, and when they enter the cell, they get processed. You know what the word of processing means? The food gets changed to something else. Energy is produced, hormones are produced, other cells are produced. Are you following me or not? For example, if this cell happens to be a bone cell, it produces red blood cells and white blood cells and platelets, so a cell produces other cells also. And enzymes are produced, and everything in the body needs is produced inside the cell. When we look at these components right here, each one of them uses some of these ingredients called food. So if we are talking about a disease can occur inside a cell, such as bone, or joint, or skin, it has to have a problem first of the food. It's not getting there. Either by deficiency of certain nutrients, or you ate the wrong nutrients. You understand the wrong nutrients. Take example, protein. You can have vegetable protein, you can have pork or beef protein. Fat, you can have lard as fat, you can have oil. So you can, the cell will, if it gets the wrong nutrients, or it doesn't get the nutrients, and that creates the first problem called disease inside the cell. The second problem occurs inside the cell is when these cells, inside here there is the nucleus, there is several organs around it called mitochondria. They take this nutrient and they make energy, hormones, and all kinds of things. Also they produce what? What does the cell produce?
More cells.
Toxins or waste. The waste inside kill cells. It kills them. So hydrogen peroxide is poisonous to our body to drink or to eat. Or we can call it free radical. You heard about free radical. All the same name. It's basically a molecule like ozone has extra oxygen in it. And whenever you have extra oxygen produced in it, H2O2, that's not H2O, which is water. It has an extra half an atom of oxygen, which is unstable, and it creates disaster in the bacteria body. You put hydrogen peroxide over a bacteria in your skin, immediately the bacteria will take the hydrogen peroxide and convert it to H2O plus half oxygen to make H2O2, and half oxygen is not oxygen. It needs another half to become oxygen. It sucks that half oxygen from the bacteria, kills the bacteria. That's the process of bacteriocidal of how we kill germs. We kill germs by depleting them from something necessary in their life, such as oxygen or something like that. The reason I say that point right here is aging, because there are some people around selling hydrogen peroxide to the people to drink in the United States. I don't know if you heard about that. Have anybody heard about people drinking hydrogen peroxide? You heard about that. And I bring it up because there is no secret about it. Hydrogen peroxide is a chemical, and if you look at the bottle itself of hydrogen peroxide, it says warning, it's a poison. But the person who's selling that, telling people, it removes free radicals, it removes chemicals, it makes you younger, and of course that is not chemistry, that's garbage information, that's dangerous information. But the FDA has not caught up with these people yet. The FDA are very few group of people, they're busy approving chemicals for us, and then they're not busy fighting all the chemicals that get released in our environment. So anyway, but inside the food we eat, there is a component right here called the vitamin. In the vitamins we eat, there is a vitamin called vitamin C, and vitamin E, and vitamin D. Also, there is another component called fat, polyunsaturated fatty acids. And also there is another component in the fat called lecithin. And you follow me so far. These supplements have been found to have very powerful anti-aging effects to the body. Am I going too fast or that's clear? They found to have, if you put the vitamin C or the vitamin E or the vitamin B, sometimes beta-carotene even does that, but not that very much, and lecithin or oil against that oxidant, hydrogen peroxide, it destroys it and gets. This is why we call the vitamin C and the vitamin E and the vitamin B and the lecithin and the oil anti-oxidant. Because they are against oxidation. So aging process is a process of oxidation. We get oxidized, we get rusted by the chemical we produce inside the body. Everything I say in this lecture, when I go through very fast through things like that, you have to listen to it again if you have a tape recorder, or watch it in a video, because every piece of information behind it, there is a lot of information. When I say vitamin C and vitamin E and oil and all of this is important for aging, I'm not going to talk anymore. I'm just going to move ahead, but you have to bring it out again and think about it and teach it to your kids first, your parents second, your friends third, apply to yourself, then you see that you are creating a healthy society around you. So these vitamins, as an antioxidant, they have what we call hands like this. This is the vitamin C, has two hands over his head. and go out with it. That is good cleaning practice. It happens in the bloodstream. It happens in the mitochondria inside the cell. It happens in the liver in detoxification. It happens in the joints. It happens in the brain because the brain has to clean itself. Also happens everywhere. So vitamin C, as a water-soluble vitamin, can sneak through areas that oil-soluble antioxidants cannot reach there, such as the brain, the joints, and many other areas like that. So this is why we say vitamin C is number one antioxidant you can consume. This is why the double Nobel Prize winner Linus Pauling, which we have to respect also, he has used vitamin C in his research. Do you know that Dr. Linus Pauling, who has 2 Nobel Prizes, that person, when he announced that vitamin C is good for your body, for our health, was called a quack about 18 years ago by medical doctors who didn't know anything what vitamin C even looked like. And the man who had a Nobel Prize was called a quack. Do you know Dr. Lind, L-I-N-D in England, who discovered that vitamin C can cure scurvy? The bleeding teeth in the soldier was arrested and put in jail, and his medical life was finished that time. So you know that Dr. Schultz, American doctor, who discovered vitamin E, that's very important, was had to leave the United States and run to Vancouver, Canada, because he said that vitamin E is good for health. Do you know that I myself, in Richland City, Wisconsin, in a lecture in 1972, when I said vitamin C and vitamin E and vitamin E antioxidants, and they are good against these diseases, I was arrested that time by saying that. I'm misleading the public. But anyway, nobody wants to fight something in society against big power that's going to have it easy. Either you got to deal with your conscience and God, or you're going to have to deal with the company of people. And if you believe what you're doing is good, you got to stand for it. Regardless of what you're going to lose. You're going to lose money, it comes back. You're going to lose your license, big deal. You're going to lose your job, you find another job. But you got one thing left, that you are doing inside you what's going to count in the end. Are you following me on that? And this type of consciousness we have to raise. We have to bring in our children, and that you have to take care of yourself first in the diet you eat every day. The aging process starts right there, inside the cell. And a lack of vitamin C will do that. Vitamin E also is another antioxidant. Vitamin E, it has not only 2 hands, 3, 4, 5, 6, 7, 8 hands, that it can grab 8 chemicals out of the system. This is why vitamin E is a water-soluble, it's heavier, and you don't get rid of it very much. And you need more vitamin C than vitamin E. The other thing is, if you look inside the cell here, about 1976, New York Academy of Science. I think 76 or 77, I'm not sure exactly the name. They made a convention in New York for all the nutritional science biologists from all over the world who work with vitamins, to see what can we do to save our health. These biochemists working in laboratories all over the world were not working to be rich. They working to gain fame. They want to publish a paper. And they found out that there's a substance in the membrane of the cell, right here. If it is lacking, the cell will die. that substance was identified as vitamin E or alpha-tocopherol. So alpha-tocopherol was discovered to fight chemicals and clean the cell from inside. So if we are talking about what is number 2 problem can cause death of the cell or aging or accumulation of what? Oxidant material inside our body. Well, if this is that easy, then all you have to do, be sure that every cell gets enough food, be sure that every cell taking the chemical out, and you stay healthy. Is that possible or not? Is it possible or not? That's exactly what I did when I went to medical school. Before I went to medical school, I was a biochemist working in a hospital in Los Angeles. I was lecturing to people and doctors and everybody about health and nutrition. And the biggest problem I have found, every time I lecture, they say, what kind of gradation do you have? People, unfortunately, in the Western world, United States and Europe, they don't go with your knowledge. They go by what credit you have, how old are you male or female, are you black or white, who's your family, and then in the end, what's your knowledge. Because I have met many people without any degree know more nutrition than the best doctors I know. But they can't go and speak because they don't have the MD, the PhD, the BA, all this stuff. Papers and walls do not make people. It is the knowledge in here and applying it what makes us good humans. So in any way, I went to medical school with one goal in my head, that I will learn everything about diseases, I will be the best diagnostician, and I will apply the same principles in my practice. How to supply good food, how to get rid of chemicals. Sounds very easy, but it is not. To supply good food, you have to go back and look to this skeleton right here. To supply good food to the cell of the joint and the skin, first of all, your diet has to have what? Your diet you have to eat what? If you have to have all of these things delivered to the cell, then the diet has to have what? Protein and carbohydrate and fat, vitamins, water, minerals, and enough oxygen. Then the question has to be, are we getting these in our diet? And if we're not, then let us think about it. Are we getting enough protein and carbohydrate and fat, or the right kind of protein or not? When you study our diet, you find out for years the consumption of, from the year 1900 until 1990, the consumption of the vegetable protein went down, and the consumption of animal protein went up. But that's true or not? There are more and more hamburgers and hot dogs and all this type of protein rather than salads and vegetables which have lots of protein in it. Can eating the wrong protein cause our disease? And the answer is yes. Then let's put this aside and look at another factor. The other factor is carbohydrate. What is carbohydrate? What does the carbohydrate do inside your body? They give you energy. Carbohydrates give you energy. There are two kinds of carbohydrates you can consume. Actually, there are three kinds of carbohydrates you can consume. You can consume simple carbohydrates. You can consume simple carbohydrates. You can consume complex carbohydrates. Which one is better for us? Complex carbohydrates. But which one anything is sweet is sugar. So how about grapefruit? It's not sweet. It will be what? It will be complex. How about orange? It will be what? Simple. It's the degree of sweetness makes a food carbohydrate good or bad. We're not saying don't eat fruit, but we are saying don't make fruit your main diet. Because your main diet has to be bread, starches, macaroni, spaghetti. Then fruits should be just supplement to that. Sugar became very popular. And the consumption of sugar in the United States has gone up like this as a main source of that, which created tremendous amount of disease. Sugar itself created hypoglycemia, created diabetes, created mouth ulcers, created pancreatitis, and many, many other diseases, and led to schizophrenia, led to depression, and you can name it. Sugar. So, when you look, you come in here tonight, you said, I want to see the magic cure Dr. Nasr has to get rid of my osteoarthritis, osteoporosis, and all. There is no magic. There is nothing magic in nutrition. It takes you years to develop your problem. It takes you years to get better. It's not going to happen overnight. You follow me or not? And anybody tries to sell you something, says, take this, it's going to get rid of your problem, don't buy it. Unless it's drug. If it's drug, and the doctor says, take it for a headache or take it for something, then you might want to take that. But actually, most of us can do without those drugs. So, with consumption of sugar leads to a big problem. Consumption of sugar leads to consumption of a simpler carbohydrate. Much simpler carbohydrate than sugar. What do we call that? Simpler carbohydrate. Much simpler. You cannot be simpler than sugar. Sugar is 6 carbon atoms, you cannot break it. But it can break to 3 molecules, each one has 2 carbons, we call it what? By fermentation, we call it alcohol. So alcohol is a natural substance, organic, that is even simpler than if you drink alcohol, you're going to have energy a lot faster. That is not good. But the guy who drinks alcohol, he thinks it's good. Because he gets the energy out. So that is the way we have lived through our disease, that we are not consuming the proper carbohydrate. Fat. Are we consuming the right fat? There are 2 kinds of fat in our diet. One fat called saturated, one fat called unsaturated. Somebody can tell me what the saturated means and unsaturated means. What does unsaturated mean? Just guess. Doesn't matter. Not an example. Yes.
Your body doesn't absorb it as well.
No. There is a reason. The word itself explains itself. The reason behind it, if you look at everything God created on earth, it's unsaturated. Unsaturated means an atom that have the ability, have the ability to react with others and create a chain reaction. When we saturate minerals like atoms, like uranium, plutonium, we start saturating it starts getting to be very dangerous. These atoms right here, in food, we call them vitamins. We call them minerals, and we call them protein and carbohydrates and fat. All of these are unsaturated. A vitamin has to be unsaturated, means the hands are empty. Unsaturated means their hands are empty, so they can react with each other. A mineral has to be unsaturated, like calcium, So it can react with carbonate and can also make calcium carbonate. A sodium has to be unsaturated so it can make sodium chloride. Have you ever tried to eat sodium alone without chloride? Have you seen it in the laboratory? What happens when you put sodium in water? It makes fire. Because sodium is unstable atom. So everything is unsaturated. One of the unsaturated foods we need called oil. The oil has molecules like this with hands open like that. When we eat oil, they are unsaturated. They go inside the body of the oil, and they join each other in the adrenal gland and make adrenaline and cortisol and testosterone hormones. So, fat is very important for your health because they make hormones. Hormones are made of fat. So when we have saturated fat, it cannot react inside the body and will become a burden on your body. Your body has to get unsaturated vitamins to grab the whole thing and take it out. You understand? This so far enough. So when we eat something saturated, like margarine, lard, the animal fat, when they go in, some of it, or most of it actually, is going to cause more burden in the body compared to the polyunsaturated fatty acids. Because polyunsaturated fat, that's oil, when you take it, is going to do nothing but good. Because oil doesn't have cholesterol. There's no oil that has cholesterol. It's impossible for oil to have a cholesterol because cholesterol is made of oil inside the body. So oil is free of cholesterol. Where lard and pork and a beef fat is full of this cholesterol. And even cholesterol is not our enemy anymore. Our enemy is the low density lipoprotein, the LDL, which is the fat comes in from the saturated fat. Am I going too fast in that topic in this point? So anyway, if I'm going fast or not, I'm going to continue anyway. I have to get home. So what kind of fat we are eating? We are eating more and more saturated fat and less unsaturated fat. Can the consumption of saturated fat cause problems inside our body? It causes problems. It makes a substance called LDL. Have you heard about LDL? Let us talk a little bit about LDL. What is LDL? You look at your arteries inside, and the liver right here, all the fat you eat from outside, all the fat, the good or bad, has to go to the liver, and the liver will convert the fat, all the fat, to something called LDL. Low density lipoprotein. The low density lipoprotein has to come out and travel in the bloodstream and go to each cell in the body and give it energy, make hormones, and do all this good stuff. So LDL actually inside the cell is a good fat. But let us see why it's a bad fat. LDL is a very small fat. L stands for what? Low, and D for density, and the other L, fat protein, lipoprotein. Low density, small, very sticky. If it goes in the bloodstream, it never reaches what? It never reaches the cell. What's going to happen to it? It's going to It's going to deposit because it's very sticky. So what does the liver do? He combines one LDL with another LDL, with another LDL, with another LDL, and makes high-density lipoprotein, HDL. And HDL comes out, and it is not sticky. And HDL will go to the cell right here, enters the fat, and breaks down to little, what? LDL again. But it's not sticky because there's no blood inside the cell. So the problem is not cholesterol. The problem with our diet right here is that we are consuming the wrong type of fat. This is fine, that skeleton disappears on under, right here. So we should start consuming the right fat. Vitamins. Are we consuming enough vitamins for ourselves or not? Let us look at the food we eat every day. Vitamins are made in vegetables and fruits. The best of vitamins to stay healthy with are, we call them antioxidant vitamins. And those are the C, the E, and the B, plus other things that are not vitamins but good food, such as fat and lecithin. All of these are the stuff that causes us to stay young. When a plant makes a deal inside, like a vitamin C right here, and that plant grows in California, or Florida, or any place, and the air has oxidants such as carbon monoxide, lead oxide, zinc oxide, nitrogen oxide, and all of that, what these oxidants will do to that vitamin inside the plant. What's going to do to it? It's going to destroy the vitamin in the plant itself. It's going to oxidize it. You understand that? So getting this nutritious spinach, nutritious oranges, nutritious tomato, and eat it with this vitamin in it being oxidized, it will not do that much good inside the body. So taste doesn't mean anything. Taste, if the food is tasty, doesn't mean it's good. We have to be sure that this food has enough antioxidant nutrients. And the amount of antioxidant nutrients in our food due to smog and pollution and storage and cooking and food additives and preservatives have gone down like this. And the disease went up like that. So, we go back right here to talk about vitamins. Do we need to take some extra vitamins or not? There are two opinions about that. Some people say, the nutritionists, dietitians, and medical doctors say you don't have to take any extra vitamins at all as long as you eat proper diet. Show me a proper diet in McDonald's. Show me one in Burger King. Show me one in our schools. Show me one we eat at a restaurant and I eat it. But that is the food you and me eat every day and our children, isn't it? So let's not fool ourselves. Vitamins is going to be deficient inside the body. When the vitamin is going to create deficiency, it's going to create aging inside the body. So we have to take extra supplements of antioxidants such as vitamin C, vitamin D, vitamin D, lecithin, and all that stuff. Do we have a blood test to tell us if we eat enough vitamins or not? No. There is no blood test. Because the blood test cannot identify between a dead vitamin and a live vitamin. The blood test cannot do it. So the best thing to do, assume that you need it and take it and see if it works or not. You're going to find somebody saying, no, I don't want it. What can you do? That's fine. So I'm going to take mine. You don't have to take yours. 20 years from now, if you're still alive, let us see which one have cancer, which one have arthritis, which one having problems. And I have been in practice for about 16 years right now, 15 years actually, and I have seen that people who take good care of themselves are much, much healthier than the people who are not taking care of themselves. So, the food we eat outside is important. Water. Are we consuming the right water for our cells or not? The amount of water consumed in the United States from the year 1900 until now has gone down like this. And the amount of beer and 7-Up and Coca-Cola and all that went up like this. Water means water. Without sugar, without additives, without alcohol, without caffeine, without anything. Water means water. That's what the body wants. When we ask the cells inside right here, what do you need? It doesn't say, I need some alcohol. It doesn't say, I need some beer. It doesn't say, I need some coffee. It says, I need some water. And that's what we see inside the body. Then we should give it water. But the water we drink is also polluted with chemicals. And recently, in the last few years, many companies, including Shackley, have made water purifiers, water filters, and so on, and that's probably the best way you can do in your house is just get some water purification system for your drinking and your cooking. But actually, one of these days, each house has to be equipped with a machine much bigger than that to even for taking a shower. Because the chemicals in that water actually will also go, when you take a shower, it goes in the skin and poison the skin in the pores inside. And so minerals and oxygen are the same thing. So actually our biggest problem of aging is that what we consume is not very good. The second problem. You get the food inside your intestine. It gets digested. It goes to the small intestine, it gets absorbed. Absorption depends on how much fiber you have. The least fiber you have, the less absorption you have. The more fiber you have, the more absorption you have. Fibers do not get rid of cholesterol in the blood, like Quaker Oats and people like that say. It does not. But listen to that. But fibers in your diet have the ability to absorb the saturated fat from your food. And if you take grass and give it to Exxon and put it in the ocean, all the oil they have right there would become organic, would disappear. Because fibers have affinity towards oil. Cellulose does that. Good example, piece of wood, a piece of paper, put oil on. You cannot get rid of it. It sucks to the oil right away and you have a spot. Because cellulose likes oil. So fiber is cellulose, and cellulose is good in the diet. When you have a bigger bowel, you have more absorption, and then you can deliver in the body better nutrition. Do we have enough fiber in our diet? The amount of fiber that we eat every day has gone down like this also. So the disease process continues to develop. I will go a little bit faster so we can get to the joint. Then this food has to travel to the heart, and from the heart has to go all over the body through a system called our arteries. And if the arteries are blocked, we will have poor circulation. If you have poor circulation, you cannot deliver enough nutrients, then there is a disease. then in the very end result, the cell is not getting enough nutrients. So you can eat it, but if you don't digest it, you still didn't get it. You can digest it, but if you don't absorb it, you didn't get it. You can absorb it, but if you don't push it through with a good heart to the brain, to every place, you still didn't get it. So this is number one problem right here. This problem right here is easy to take care of. Get rid of aging material. We use nutrition to do that. But there are two kinds of aging material. This cell is still alive. But there are cells in the body full of chemicals and they have died. Once the cells die, they create a scar tissue and then they no longer can be in the body. Those are the cells that are causing problems in our arteries, in the heart, and every place. And anybody tells you, take that supplement, or take that medication, or take something will dissolve your plaque, will get rid of it, it is not true. That is nothing can dissolve these plaques out of the body, except chelation with EDTA or surgery using laser or anything to break it up. But if you use laser, you can't, because this deposits all over the body. What are you going to do? Put the laser all over the body? You can't do that. One of the organs that suffer the most are the cells of the joints. The cells of the joints, if we look at the human body, we find out there are joints in the back, called the spinal cord, the vertebral column, connected to a big bone called the pelvis, connected to the hip pocket right here, and then goes down to the knee and so on. Why did I select this part right here? Because this is where most of the problems are. Knees bother some people, ankles bother some people, hands bother some people, but most of us bothered with low back pain, hip pain, and the joint pain. When we look at these joints, we find that the joint is made of a bone like this, covered with what? What is substance cover each bone? No. The substance that each bone has to be covered with. Have you ever broken a bone? Bones are very tough. If they break, they are very sharp, right? Okay, if you have two bones touching each other, they cause pain. So God put a substance very tough on the top of each bone called a what? Cartilage. Cartilage is not a bone. Cartilage is hyaluronic acid made from vitamin C. That's cartilage. As a matter of fact, every place you look that there is a lubrication inside the body, there's lots of vitamin C. Every area needs lubrication, has lots of vitamin C. Saliva has lots of vitamin C. The intestine has lots of mucus, that's vitamin C. The joint has this cartilage and also have a fluid here, what do we call it? Synovial fluid, which is also hyaluronic acid with lots of vitamin C. This is the joint. The joint connected to what are these things right here that they look red? Muscle. Connected muscle. And the muscles controlled by nerves. So, if we have a joint disease, the problem can be, number one, containing the bone getting weaker, such as osteoarthritis, immune system starts eating the cartilage away. We call that disease what? Rheumatoid arthritis. Or the fluid itself can be in trouble. The fluid might be no good. That is in case of gout or infection. With syphilis, with Lyme, with gonorrhea, with TB, with any bacteria or viruses can destroy the joint. So if we want to talk about joint disease, two diseases we have to concentrate on right now. One, the bone disease, weaker bone, and osteoarthritis. Forget about the other two, the other stuff which is not common. When we look at the bone, we find all the bones in the body have the same characteristics. They have fluid inside, and they have a capsule to hold it together, and they have a bone. And the bone has to be strong. The bone is made from cells. The cells are full of what? Calcium. And one thing I have discovered in my practice, very interesting. About 15 years ago, I started seeing lots of women that they start having weaker bones. Their bones start having holes in it, holes like this, called osteoporosis. And those women were taking enough calcium, enough vitamins, taking everything. As a biochemist, start thinking about it. Why is that? I start looking at the hormone level of women. Find out there is a big problem. Start to look at the hormones, find out that the estrogen hormone is the hormone that takes calcium from your diet and puts it inside where? Inside the bone. And without estrogen, all the calcium you take will go out. It doesn't get in the bone. You can take tons of it, it's not going to go in the bone. Where men don't have the same problem. Because men still make estrogen hormone until the age of 100. Women, they start having lack of hormones by the age of 40. And the society starts, doctors tell the patient, it is normal, if you're aging, you are in the menopause, you are getting old, what you're complaining about, and all of these things. As a biochemist, I said, can we reverse that? Then I start giving estrogen. About 12 years ago. Well, here I am, the guy who is anti-drugs, and I'm giving estrogen to my patients when the time that everybody was afraid of what? Cancer. But I said, it doesn't make any sense. I don't believe that cancer theory, because if estrogen for cancer, God will create estrogen in women to start with. From why he created the estrogen when she's 11 to menstruate. Why they don't have cancer? So it must be that if something else the body makes prevents cancer. We find that the progesterone prevents cancer, estrogen can cause cancer. Then we start giving estrogen and progesterone together, and every single patient I have, over 7,000 women, and the osteoporosis, 99% disappears. You take an X-ray, 1 year, it's all white. It's all porous. We take an X-ray next year, it's better. Take it for 30 years, it's gone. And the only explanation to that estrogen is doing that. Estrogen alone? No. Estrogen alone does not take the calcium in the bone. Estrogen cannot take the calcium in the bone without alfalfa. Because alfalfa has a vitamin D that it brings the calcium out of your gut to your bone. And let us look at the bowels right here. This is your intestine now, and you just ate some calcium. of the calcium get in the blood. Calcium cannot get in the blood by itself. Do you know that or not? There are certain nutrients will never enter the body unless your body wants. One of them is calcium. For calcium to enter, there's a guy sitting right here in the bowel wall with two hands. He has to take the calcium and put it inside the bloodstream. This guy is vitamin D, which you get it from alfalfa. That's why we say alfalfa is good for arthritis, is because the vitamin D in alfalfa is what helps the calcium to be absorbed. But once the calcium is in the bloodstream, it cannot enter the bone without what? Without acid. So, we can then give people to check the blood first. When we check the blood, we know what normal is. If the normal is 200, we find I have a patient today she was 0. She's 51. And she doesn't have arthritis, doesn't have any problem. And I told her, I know you don't have any symptoms now, but wait 5 years. Your back will start going forward, you start going like this, you start having achy bones and aches in your joint. That's what osteoporosis does. So osteoporosis is reversible and curable disease. But the bones that have collapsed, in your back or something, it cannot come back. But we can prevent any further ones from being destroyed. So that is the role of nutrition in osteoporosis. Tell me, some of you have mothers and grandmothers and relatives. What is the most common problem when women get old in America? What happens to them? They break their what? And they go, why do they break their head? And can happen this. And he falls to it. Because it's osteoporosis. And when the doctor tries to put the pin, it cannot go in, it's shattered, because there is nothing there. So what can we do? I have a patient, couple from Germany. They do speak English very well, and they really need medical stuff. They don't have any money, so I try to help both of them. They're about 80 and 89 years old or something like that. The man fell down, something happened to him. I don't know what happened to him. He broke his knees and hips and all of that was frozen. And using crutches, anyway, we put new hips on him, new sockets and all of that, and he was walking fine. His wife fell and broke both hips. We were talking in the past about cancer, heart attack, strokes, and all these bad things, but for that person, to have double broken hips, nobody take care of you, in pain, when you used to be, independent, that's lots of stress and agony. Then the doctor, I sent out to the doctor, Dr. He said, we cannot finish. There's nothing there. Then I said, okay, to the daughter, we're going to take her home, we're going to give her massive amounts of estrogen and calcium and see what happens. 6 months, the bones were strong. And she went surgery, she had both hips broken, was fine. She's walking right now. So actually, you cannot go to somebody who is not feeling good, have osteoporosis, they cannot walk, have all this pain, and says, your life is over. You can't take hope from anybody. Because that person who has that problem, if you give them a little bit more nutrition and exercise, get them out of the nursing home. Or if they are in the nursing home, have somebody go and walk them and give them the estrogen, all of that, you will find out their lives have improved tremendously. This, the disease called osteoporosis, number one. Number two disease. Number two disease is caused by many things. It's called osteoarthritis. When the bone hits the bone. How does the bone hit the bone? How your bone can hit each other? Only if what? If the synovial fluid is not there, or it's not totally lubricated. And the other thing is, if your bones touching each other because the muscles are not pulling them apart. Are you following me or not? And the third, trauma, like banging the joint all the time. That's the third one. And let's talk about all of them. First of all, when you look at our life here, I'm not talking about everybody here. Okay, there's lots of people right here taking care of themselves. We are talking about you take this information and give it to somebody else. When you look at your back, right here, carrying weight, you find out that there's something right here called muscles hold the back together. In the back and in the front. There are two muscles in the back called rectus abdominalis. There's one right here and one right here. Huge ones. And there are two in the back. Huge ones. And there are more little ones around to support and help. Those two muscles in the front and two muscles in the back they're supposed to be very stiff when you need them to be stiff. And they're supposed to relax when you need them to relax. Are you following me or not? So they are under your command. If you want to lift something, they should get stiffer. And the two in the back, the same way. The two in the back and the two in the front. These muscles separate the joints apart. If you look at the Olympic Games, the guys who lift weights, and he's lifting, let's say, 500 pounds. What is the pressure in this point right here? How much pressure you think in this point right here? Just guess any number, and if you're wrong, I'm going to tell you wrong. Because we measured it, huh? The pressure here is going to be higher than the 500, of course, right? So we will get 1,000. What is the pressure inside here? Inside this joint? About 0. Okay, what happened then? This guy lifting all this weight, and you see his sister and rib and all of that, and the pressure is 0 in the joint. Why the pressure has to be 0? You better have 0 pressure. What for a good reason? Because in between them there are what coming out of there? Nerves going to the heart, going to the every place, and if you get pressure on them, they're going to break. So they have to be different. What makes the back stay holding 500 pounds? The muscles. What do the muscles do? Look at the muscles. The muscle is like a hydraulic hose. Has valves, the veins have valves, and they close here and they close here. Under your command. When your brain says, stepping up, they will stepping up. The valves flow. And tremendous amount of blood goes in. And if we apply, how big is this muscle? Again, let's say about 2 inches in diameter, which is not that big of a muscle. If you have a hydraulic hose in a big machine, 2 inches in diameter, under pressure, how much the machine can move with 2-inch hydraulic hose? Tremendous amount, right? The little hydraulic hose like this in a caterpillar moves several hundred pounds. So actually, we are built perfect. Our body is built perfect. What happens to this muscle? They got thick and they got flat. The cells of the muscle, they start getting full of chemicals, full of poison, lose elasticity, and they get weaker, and all of a sudden you lift something and I have the pain. And once that happens, then the next pain, and next pain, and next pain, and that's called the low back pain. Once the low back pain occurs, the bone touches the bone, the nerve will be pinched, or the bone touches upon the hip, or the knee, or the ankle, because if you go down right here, to the knee and the hip, how much pressure in the hip joint? Without muscle. There's no muscles in the hip. Not that much muscle, but 250 pounds. There's no nerve there. So there is very little muscle there. 250 pounds. In the knee, 250. 250, and the foot the same thing. If you take this person here and have him go up and down, jogging, what happens to the pressure in the knee and the hip? It goes up or down. If you jump from here to down, how much more pressure increase? The 250 pounds will go up, right? There is an equation about that. It goes to maybe 500 pounds. So you can jump once in a while. It's okay, but you cannot jump all the time, like jogging. So jogging, weightlifting, and exercise without being prepared will make joints and bones touch each other, and once they touch each other, the cartilage, it disappears, and then spurs start occurring, and we call the disease osteoarthritis. Can we reverse osteoarthritis? The answer is no. I have not succeeded in single patient reversing osteoarthritis in 15 years. When the damage is there, I always see it every year. The same spurs, the same broken bone, the same stiff bone, and everything. But the people have less pain. What did we do? We told them, increase your muscle exercise by rowing machine, by stationary bike, by walking gently, and then the muscles get bigger and bigger and bigger, and the knee and the hip will have less pressure and less pain. Osteoarthritis is the second crippling disease. You might have a good heart. You might have a good heart because you take your vitamins, you take care of yourself. You might not have cancer. You might not develop a stroke. But if you can't walk when you are 70 or 80 or 90 because your head and everything hurts, you're just as bad as if you would have a heart attack. You understand? So the quality of life is what counts, and this is what you're going to get in the end. What you do today, you get it later. What you heard today, you're going to get the results later. And unfortunately, that's what's happening with our kids. They try to tell them, don't do that, they don't believe it. Don't take vitamins, they don't believe it. Don't do this sport, they don't believe it. Until they get older, they find out you were right. But sometimes it's too late. But right here are the two most common diseases, osteoporosis and osteoarthritis. How can we build osteoarthritis back? By exercise. How can we build osteoporosis back? By alfalfa and estrogen. We have seen men with also osteoporosis, not so many of them, but we have seen that, and we give them estrogen. One of the problems we have found in women, and men both, that women between the age 25 to 45 start having change in her hormones. The estrogen, progesterone ratio, is what makes you feel good. Female hormone estrogen, what makes women a woman. It protects her from osteoporosis. It protects her from LDL. It protects her from coronary artery disease. It protects her from aging. it keeps the skin nice, it does all of this thing estrogen does. It does, but progesterone is there to make the person feel good, emotionally feel good. So when the progesterone is low, you have TMS. When the estrogen is low, you have osteoporosis. And the ratio has to be maintained. And we do that by checking the blood once a year to see if the ratio is continuing to be maintained or not. The men, I just had the summer visit here. I have found out this problem about 12 years ago. But this year we have found out that men between the age of 25 to 45 also start having testosterone to cortisol ratio change. When that change, they start having problems with mood swings, with emotional problems, start doing all kinds of things, and it gets worse in men when they get home. So there is a hormone imbalance in men, there is a hormone imbalance in women, and both of them can be corrected. The title for the lecture today is the following. We have a disease called joint disease. You have a joint disease, or you have aging of the skin. The first thing you want to know, what's the diagnosis? What is my problem? Is it my joint disease? Is it osteoporosis? Is it osteoarthritis? Is it gout? Is it Lyme disease? Is it rheumatoid arthritis? What is it? Why the joint is hurting? Same thing with the skin. Skin problem, most of the time, will improve from underneath. What the skin needs the most is moisturizer in the top to prevent the dehydration, good circulation from the bottom with massage and with heat therapy and all of that. If you have the moisturizer and the sunblock and you have the nutrients coming in, the elastin material can rebuild again, and then some of the wrinkles will disappear. Once the diagnosis is made, it has to be treated with number 1, number 2, number 3, and number 4. Diagnosis, it has to be to number 1 is medicine, medical treatment. If a person has severe osteoporosis, severe osteoarthritis with so much pain, we have to give them pain medication. If they have pinched nerves, we have to give them pain medication. If they have so much spasm in their muscles, we might have to give them muscle relaxants. But that medical management should be temporary, only for 6 months. During that time, we better concentrate on nutrition and build it up. Increase the nutrition. And go to number 3, which is getting rid of stress and having more exercise and having more sleep. More exercise and more sleep. Good night's sleep is good for the muscles and the joints. Good exercise is good for the muscles and the joints. But when you exercise and you don't have a good night's sleep, then you're going to ache all night, and then you're going to have problems next day. Stress itself can create joint disease, right? Under stress, your muscles are so tense, they pull the vertebra one way, they pull the other way, then you have spasm and tension, headache here, and you have many problems. We can help these problems many ways. By exercise, by sleep, by meditation, all kinds of whirlpool, anything you can do to relax the muscles is good for it. But nutrition, so number 2, and that is number 3. Are you following me or not? Because we just don't go do all of this and leave the nutrition and leave number 1. Because if you're exercising a joint, you have a hip joint, a hip pain, and go, hey, let's go exercise, it could be broken. You don't want to exercise a broken joint. So you really need a diagnosis first, the medical management followed by nutrition management, followed by the one of these are chemicals. Get rid of chemicals from your body. Enemy number one, chemicals we have in our environment are heavy metals. Lead, mercury, arsenic, all of those that you have in Lake Michigan, in our wells right now, full of it. When they enter the bone, they don't leave. When they don't leave, they damage the bone. So these chemicals we have to avoid. Number two, if there is an infection, we have to get rid of it. Some people have a chronic virus in this. I have people have a chronic Epstein-Barr virus in their joint. And when we give them gamma-globulin injection for the Epstein-Barr, they feel better. Some people may have fine Lyme disease in their joint. When we give them the tetracycline and the receptor and the antibiotics, they feel better. And trauma. Cut down the amount of trauma you cause into the joint. And anytime you're going to abuse a joint like tennis elbow, you have carpal tunnel, it's abuse of the rest, tennis elbow is abuse of that, the broken shoulder from an injury or something like that, all of these things need to be corrected. And if it cannot be corrected with nutrition and rest, then you have to take medication. And if you cannot correct it with medication, you might have to have surgery on that joint. Okay, that's about it for the lecture today. I'm going to take some questions for the next 10 minutes. And, I will give you my number in my office. That's green now. Okay. The number is 708-356-9009. That's on my Villa. If you have any questions, you can call there. If I'm not available, talk to my assistant, Dr. Percy, at 708-843-8860. Now, I think we covered what I intended to cover tonight, the arthritis and proper nutrition, all of that, and I'm going to take some questions if anybody has any. Anybody have any questions? Yes.
Would Candida yeast cause problems in joints?
Candida is infection. If it goes in the bloodstream, indicates that there is a problem with the immune system. Yes, it can enter the joint, but very seldom I have seen Candida able to cross brain barriers or joint barriers. The synovial fluid is so tough for Candida to cross. You have to have a very small germ to cross that barrier, like a virus. When you have a flu, you feel the ache in your joints, right? Because virus can go every place, or headache, but Candida cannot cross that. But if it's injected there because you have trauma or you have injury to the joint, this has to be treated with medication like amphotericin or gerifactin from the medication. Yes, sir.
Is a chiropractor fit anywhere?
Yes. Chiropractor basically manipulation, what it does, once he has a diagnosis and there is some kind of a spur forming, this manipulation he does, it breaks off the sperm, it relaxes the muscles so that there's less tension, but that is a chronic treatment, needs to be done over and over. If the person can do that, that's good, but if you can't afford doing that, then you're going to have to get a massager, electric massager at home, or you have to have whirlpool, you have to have something to relax those muscles. Yes, in the back.
How much estrogen and vitamin C would one person know take to prevent heat osteoporosis?
You mean calcium?
It's something in the estrogen.
Estrogen. It depends on what we see in the bone. I calculated according to guessingly how much the lady is missing. Some people we find they're missing 20 grams or 30 grams, then we have to actually calculate that. It comes to about between 6 calcium, magnesium, or shakri to 18 a day. Between 6 to 18.
Is there a preventative? I mean, can someone start taking it now, or do they have to be tested?
Well, if you take calcium without estrogen, the calcium can accumulate in the blood and can precipitate if it's not going to go in the bone. So you can take some, like 3, 4, 5, 6, it's okay. But when you get to 1,800 milligrams or 2,000 milligrams, I think it's too much without having enough estrogen in the body. Yes?
Can you produce your own estrogen?
Well, that's a good question. I have seen women produce their estrogen until the age of 60 with no problem. I have seen some have zero estrogen at the age 40. So apparently there are some glands can help to produce estrogen, maybe the adrenal gland. But the only thing we have to go with is what's the blood value there. If the blood value is low, then it is low. Yes, go ahead.
Being a severe PMS sufferer, I've been on a treatment to rid myself of that problem with a vitamin, which has helped me. I don't suffer anymore.
Mm-hmm.
But what vitamins am I taking that is producing the progesterone, and what vitamins am I taking that's producing the estrogen?
Well, you have to remember, PMS not necessarily a progesterone deficiency. PMS, when you have any hormonal exhaustion, pituitary exhaustion in the brain from stress, will create PMS. Hypothyroidism will create PMS. Adrenal insufficiency creates PMS, and low progesterone creates PMS. Sometimes we treat PMS with muscle relaxants, sometimes we treat with plus vitamins, sometimes we treat it with progesterone plus vitamins, even primrose oil plus vitamins. We try different things, but it depends on how much the stress that the individual has in their environment. Because progesterone, like cortisol is a natural substance your body makes to make you feel good. Progesterone also is a natural hormone, makes you feel good. Adrenaline is a natural hormone, makes you feel good. When those hormones get exhausted and low, then you have general depression, and PMS is one of the symptoms. Yes, sir. Vitamin D complex, yeah.
I'd like to know whether or not there is an alternative treatment for a person suffering from pernicious anemia or malabsorption syndrome.
Uh-huh.
An alternative treatment other than injection of vitamin B12 to treat or to cure pernicious anemia.
Pernicious anemia. Well, unfortunately, I have not found a successful alternative treatment for pernicious anemia besides injection. I have used D-complex and high dosage and B12. But you know, if you know, it seems like you know some medicine, you know that B12 has to have a substance from the stomach to take it and make it absorbed in the cecum in the bloodstream. People who have intestinal problems, the transit time the food takes from spot A to spot B is increased, or they have less fibers, they will have less absorption. So what we do, we improve the diet in general, and then we do the CBC. If the MCV is over 100, then we assume it's a B12 deficiency, which most likely it is. Then we wait another 2 months, and if that's not corrected, we start giving them B12 injections. And there's no way around it. Because something in the stomach damages the cells that they make the pernicious factor. And if that damages, then we have to give it to the people. But nutrition in general is the most important factor in healing. Over anything, over surgery, over drugs, over anything. Still nutrition. And people come to me and say, gee, how come you healed me or you did that? I didn't do anything except use common sense. You have the same common sense, you can do the same thing. The biggest problem with people is they try something for a short time, they get impatient, they try something else, they get impatient, they try something, they get impatient, and then they just give up. And they say, oh, the vitamin did it to me. I gain weight, the vitamin did it to me. Of course, vitamin doesn't make anybody gain weight. But that is what people say. Yes, sir.
It's possible that vitamin C could be used as a measure to make the body more absorbent in order to synthesize vitamin minerals.
Vitamin what?
C.
Vitamin D?
Vitamin C.
D. D as in Paul. Oh, D as in Paul? Okay. Well, there is no vitamin called vitamin C. There's no such thing. There are vitamins named vitamin B17, vitamin T, and all of that. These are factors in the diet that are not vitamins. And there is no scientific way we can use to measure the nutritional value of that individual. I have not found any accurate way. Take a blood test, you are checking the blood. You're not checking the tissue. And the blood is not as accurate as the tissue, right? That's number one. Number two, you do a stress test, measure the circulation. Patient doesn't have blockage, still having a heart attack. Why? Because he has other problems. He has a calcium deficiency, develop a spasm, he has a stroke, and when you do angiogram, it's perfect. And these are the things. Medicine has been established in a very good fashion in the United States. The best medicine in the world is in America. Diagnosis. That good history that the doctor should take, that takes about 35, 40 minutes, 300-400 questions, analyzing every system, finding out what's wrong, finding out what diseases can be, doing all this work. Then after about a month, you make your statements, you make your decisions. How's the body? How's the brain? How's the heart? How's this? How's this? How's this? Because many times I have somebody comes in to me with simple problem, headache. And I discover they have more serious problems than they think they have cancer. Or they have a heart attack. I have a guy working in my clinic, he's about 79, he says, I feel great, I've been taking vitamins, I need chelation. I told him, why do you need chelation? He said, I need chelation because my friend told me I need it. And he had a friend of his told me I need it. I said, well, listen, let's do a stress test. No, you don't have to do a stress test, I'm fine. I'm under stress, I'm married. Then I put him in a stress test, I find out he's about to have a massive heart attack in front of me. That person was put on medication first, and he did not take chelation. And he came for one thing, we discovered something else. So there is nothing accurate about making a nutritional assessment except the good history, the symptoms, how's the circulation, that could be a good indication. How's the immune system could be a good indication, plus CBC or SMAC. Blood test, and that's fine. Yes, in the back.
I'd like to know, what type of vitamin would you like in your body to cause your eyes to become very extremely dry?
Extreme dry?
Extremely dry, non-functional.
Dryness of the eye is the lack of the fluid coming out. And if it is a problem like going on for a long time, you have to go to ophthalmologist and find out, is it a sinus infection causing that, or is it scleroderma, or what kind of a disease causing. But in general, when you follow a nutrition program like I talked about tonight, usually you're going to notice lots of things improving in your body. One of them is your eye and other stuff. Question besides that? Yes, sir.
Taking cortisone, is there side effects from that?
Natural cortisone your body makes, you're talking about?
No.
From outside?
Yes.
Of course it is. Cortisone should be preserved only to people with autoimmune disease or people who have severe pain that they have lots of damage, or cancer patients. And if cortisone given in high dosage, it suppresses the adrenal gland and it creates damage to the adrenal gland, but it can be reversed.
And how about
About what? Estrogen doesn't cause a problem. The only thing estrogen will do, sometimes if you're dehydrated, you can have blood clots. Sometimes if you're young and you take estrogen without progesterone, you could have high tendency to cancer of the cervix. But if the estrogen to progesterone ratio maintained, I haven't seen any problem. Any other questions here? Okay, yes, ma'am. Yeah, you.
Margarine, is there any margarine that's good for you, or margarine is out?
No, butter is better than margarine. Anytime.
Always is better.
Butter is always better than margarine. Margarine is 100% saturated. Butter is 60% saturated.
Even the tub is not good. The tub margarine is not good either.
Once they, I don't know how, I really don't know every margarine in the market. If it is hydrogenated fat, it's not good. If it is not hydrogenated, maybe it's good. Maybe they take some oil and mix it with chalk or something and make it solid and make margarine out of it. I don't know. Maybe that's good. But in general, people like butter and like margarine because it's easy to spread on bread and it tastes good. But if you go to restaurants, big restaurants, fancy restaurants, they use oil and they put it in the freezer and make it thick and they brush it on all the toast and it tastes the same. You think it feels good and just have oil on it. So what you do, if you have addiction in your house to butter, use butter. If you can use bread without toasting it, it's better. A toasted bread is not as good for you as fresh bread from the oven. That's in general. Because toasting process makes carbon out of the carbohydrate, which creates carcinogen. But if you have somebody all his life is doing it, I'm not going to waste my time with my daughter and she's doing it. I said, just do what you want to do and good night. I don't want to hear it, Yeah. Vitamin C, 500 milligrams minimum is a good dose. Yes, sir.
If a woman had cancer, do you still recommend that she take?
Very good question. No. If a woman has cancer of the ovary, and still there, absolutely not. We have to sacrifice osteoporosis then and take care of the cancer by blocking the estrogen. But once she is cured from the cancer of the ovary, yes, I put her back on estrogen.
I'm talking about a woman that has had ovarian cancer and a colon cancer.
Yes, how long ago?
15 years ago.
Oh yeah, she should be on estrogen, no problem. Oh, sure. Because her cancer did not occur for 15 years, but she is going to be crippled and fall down and break her head, so you're going to have to common sense in life. That's the way it is, common sense. Okay, yes, sir.
When the cortisone, if you had injections of cortisone in it, how long does the body take to dissipate that?
Injection of cortisone in the joint, it never leaves. It always causes permanent damage in the joint. But the second injection will cause more problems, the third. And also cortisone for athletes to build a muscle, it causes tremendous damage to the adrenal gland and irreversible damage sometimes. The cortisone is a very dangerous drug in any kind of form unless it is used temporary, like 1 or 2 times. You can take it by mouth or you can take it for 30 days, 60 days. But if cortisone is going to have to be used lifetime for somebody who has rheumatoid arthritis, then we suggested that different kind of cortisone that's slow-acting like dexamethasone, or we suggested every other day rather than every day. Yes, ma'am, in the back.
I noticed that when you have muscle pain, that
Aloe vera does what? It seems to help us? Okay. As a person who has a degree in agriculture and herbiology from Cairo University, I know all the herbs that grow in Egypt and the Sahara Desert, and aloe vera is one of the things we have all the time. Aloe vera has nothing good in it except a drug called alkaloid that has a tendency to irritate the area or suck the fluid out of it and makes it feel tight, and that is better than taking aspirin or better than taking pain medication. It's a good thing to use on the skin. There's nothing wrong with that. But your muscle pain, if it is caused by other problems, other diseases, autoimmune disease, multiple sclerosis, whatever it is, you got to know what's causing the problem rather than treating it without knowing what it is. Thank you very much. Have a good night.
I think we owe Dr. Nasr a little thanks for showing up tonight with the weather like it was. He will be back again to speak on April 26th, and he'll be speaking on allergies. So if you people have allergies, or if you know people that do, it'll be here in this room on April 26th. We will have flyers out on it as we did in the past. And again, if you people want either videos or cassette tapes of tonight's lecture or any of the previous lectures, you can sign up for them up here. You can make out a check for them. Please make a check out the tapes, T-A-P-E-S. And I think that'll work for the evening.